Hello, my name is James Iannuzzi, and I'm an affiliate faculty member of the Philip R. Lee Institute for Health Policy Studies. I'm also an assistant professor of surgery at UCSF in the Department of Surgery and the Division of Vascular and Endovascular Surgery, as well as co-director of Seashore, our collaborative for surgical health outcomes and research in equity. As a vascular surgeon, I'm particularly interested in improving care for older adults with vascular disease. Vascular disease is a natural part of aging, but can drastically be impacted by lifestyle choices. Vascular disease can occur anywhere in the body and can pose a threat to life, limb, and quality of life. One surprising fact about individuals with vascular disease is that they are the oldest, most complex, and most frail of any patients that we treat surgically. While many people focus on the obvious medical aspects of this care, I'm particularly interested in the major issues that drastically impact these patients, but don't often get the recognition in our medical pathophysiological framework. One example is food insecurity. Older adults are at particular risk for food insecurity due to disability, reliance on others to obtain food, and a fixed income that may create competing demands, particularly with their medical care. Vascular disease is interwoven with food choices. Diabetes, high blood pressure, and hyperlipidemia are the fundamental triad leading to peripheral arterial disease or blockage of blood flow. We found in an initial study that those living in food deserts had an increased risk of amputation, readmission, and wound complications by nearly twofold. Further, when we screened older adults with diabetic foot ulcers, nearly half of them described having food insecurity. While there may be some really interesting and innovative approaches to addressing this, building on better interconnected multidisciplinary teams, there may be some low-hanging fruit. For instance, older adults in California are a particular risk, where 3 out of 5 older adults are eligible for food assistance programs but are not enrolled. And so simple solutions, including connecting patients to social work, may be a first step. Now, there's also major implications for not only our healthcare system, but healthcare policy. During COVID, we were expecting to see a rise in food insecurity, but this didn't largely occur because of changes to food assistance programs and bolstering those systems. Well, those changes have now expired, and it's likely to see an increase of food insecurity, particularly among older adults moving forward. I'm particularly interested in building better infrastructure and implementing policies that are equitable and address the underlying processes that we often don't give the appropriate attention they need despite the major impact on day-to-day living, and invite you to join me in this work. Thank you.